question was, why does a lot of speech and language therapy focus on teaching parents on how to use the strategies? I think simply put, there are two main reasons for that. Firstly, when we look at the research on where families did the best and where kids made the best progress is where parents were taught to use the strategies. And actually in early intervention, specifically when they did some research around programs, the programs where there were individual sessions as well as parent training, those were the ones where they had the best results. Of course, something is better than nothing. So either the one-on-one therapy or the parent training, both of those made a difference, and it was important to do that. But it was a way to at least measure, so we know for sure that it works. And there's a lot more research being done around the efficacy of that. The second, and I think the most important reason, is that parents spend the most time with their kids. And there are so many opportunities to model language, to teach language, to work on those speech and language skills within the home. Like your everyday routines that repeat over and over again, like your meal times, your bath times, the bed times. Those are ideal times to learn these skills because they're repetitive. You have lots of opportunities to build goals within that. So when we see the most progress with children is when we see the families being able to use those strategies within their everyday lives. It doesn't necessarily work to sit down with a child for an hour, to be honest, to work on some of these skills. It has to be included in their everyday routines and activities. And that's when it makes the biggest difference. So in a nutshell, that's really why that is such a big part of it. And I found that actually in the last year that we were working purely online, one of the biggest benefits of being online is when we were doing parent coaching, we could switch our cameras off. So we're invisible to the child, but we can help coach the parent through some of these interactions and to help them and talk about what went really well, what can they do next time to help support their child's speech and language skills, and how they can tweak that. Because a speech and language therapist, unfortunately, can't show up at your door and spend 2 weeks with you during all these routines. I mean, it'd be great if you could, but this is an ideal way to almost have a speech and language therapist in your home to guide you through it in a positive way and go, these are the things that's going to work for your child, and to be able to adapt it to work for your child specifically, because each family would be different. So different things might work in different situations.